This is part 3 of my videos on the Princess Diamond cruise ship and the data that came from the National Institute of Infectious Diseases of Japan. In the last 2 videos I looked at the actual data and made some graphs. In this video I'm going to show some email responses which I think are relevant to the situation. So Kimberly Higgins writes that there were new infections that occurred during the quarantine period, including officials, and it is true that in a strict sense the quarantine failed. As a healthcare worker, I was an ICU nurse in the U.S. As a healthcare worker, I admit that we have to make a goal of 0 infections during any quarantine. However, I think you have to take the situation into consideration. This was a novel virus. They weren't 100% sure how it was transmitted. There were a huge number of people in a small area, and according to Professor Iwata, the people who were actually working in that situation were emergency workers, but they were not actually trained in infection control. So I think, all things considered, if there were a few officials who contracted the virus after intimate contact with people who were sick, and that's the outcome, then I think we should consider that the quarantine was basically successful. Now again, if you look at the part 2 video that I posted, I admit it does look like there's a possibility that there was an outbreak on the ship despite the report from the Japanese government, although until there's more information that's forthcoming, more data, and not just anecdotal reports, I think we should accept that the Japanese government's analysis is accurate. In support of that is this other comment by Cheryl Molesky. She says, Paul and I watched your video and agree with your analysis of the quarantine. We felt very safe in our cabin aboard the Diamond Princess. The Japanese government had procedures that I believed kept many people on the ship safe. We felt more exposed to the virus on the plane ride to the USA than isolated in our cabin on the ship. So I think a lot of the impression that people have that the virus was spreading on the ship is actually not an interpretation of data. It's actually based on the news reports that have been coming out from journalists. So as I said in the last video, it's possible. I do think it's possible from looking at the data. There's some what we would call maybe sequelae. The Japanese government didn't do a good job of explaining the 103 people whose onset of symptoms was non-confirmed. That looks like it could represent an outbreak on the ship, but there are people who are not reporting the kinds of breaches of protocol that other people claim to have seen. So I think for the time being we have to trust that the report was basically accurate. It does tell a story which I think is consistent, and it's not entirely clear that situations like the Australians who have contracted the virus upon returning to Australia represent breaches of the quarantine. It does seem that way. I agree, although I think we should wait and see if there's any other explanation for that forthcoming. So let's stay tuned for more information in the future. Thanks.